Wonderful. Thank you so much. What a wonderful day it's been today. It's just been really a lot of fun, a lot of great energy in the room. And my favorite part about my job is that I get to meet with patient advisors and families. And that truly is the best part of my job. And the other best part about my job is that's mostly what I get to do. So this is really great. So I'm going to use our executive director, Joanne Gatton. Her and I kind of have this saying that we're like patients who infiltrated the healthcare system and we became staff members. And so we've kind of used that same model today during the panel. We have 4 amazing panelists here today who kind of just infiltrated and monitored and listened and observed throughout the whole day to listen to what was going on. And they're going to give their feedback on some of the things that they heard or perhaps didn't hear today. How are we doing? 30 seconds. Do we have any public service announcements? That would be... Oh, I got one. Okay, so about 15 minutes into our panel, we're going to get Marlies to read a couple questions from you. So I'm going to ask a few questions. We have a few facilitated questions, a few surprise questions. But if you would like to ask a question of our advisors, we want to encourage the Twitter sphere to get active. So ask your questions on the Twitter sphere using our hashtag QS2015, and Marlies will pick a couple around 15 minutes into our conversation. Are we ready? Wonderful. Okay, we've got some great panelists here today, so I'm going to let them introduce themselves. So if you could tell us in 2 minutes or less your name, what role you play as an advisor or a family member in the healthcare system, and what brought you to that role. So we're going to start right up here. How about you, Marlon?
Okay, I am actually not an advisor. I'm a PACER, which means patient and community engagement researcher. I do research with patients, and I am a patient. So that's a little bit different from an advisor. Sometimes I do work with working groups as well. But I mostly do research attached to SCNs with their PRIUS or CREO grants. I got into this totally by mistake. I was very annoyed when I came back from an appointment around having a hip replacement to be told I needed to see another specialist, or a specialist, and I had been seeing a specialist. And so I went online. I saw this site that said, Patients Matter, and I thought, damn right. Went on it, and suddenly found that it was an invitation to become part of a study that actually Tracy Roslock was part of, which was Patient Engagement Research, PEP grant. Signed up. 2 years later, 3 years later, 2.5 years later, I've now done 3 finished projects. I'm leading 4.
Excellent. Thank you, Marlon. I think we have a new hashtag for today. Patients Matter, #damn right. What do you think? Would that work? How about Karen? Go ahead.
Hi, everybody. My name is Karen Calhoun, and I come here as a family member and a parent. My son, Jed, was born in 2002. I had had a healthy pregnancy, and he was born at the Grey Nuns Hospital with many medical complications that we weren't aware of during my pregnancy. So whisked into the wonderful, beautiful world of the Stoller Children's Hospital. They sent the neonatal transport team to come take Jed away, and I had had a C-section. That was definitely the hardest and saddest day of my life, to have my newborn baby taken away. We spent the majority of his next year at the Stollery. He was diagnosed with a genetic syndrome that came with it many medical complications requiring surgery. So we were in and out of many of the units at the Stollery, spent lots of time in the intensive care unit, and he underwent lots and lots of surgeries and was silently aspirating the whole time we were there, so developed pretty severe chronic lung disease and spent a lot of time ventilated. And it was a very difficult year for us, for sure. My husband and my 3-year-old daughter, she was 3 when my son was born, and we learned a lot that year. We grew a lot, and I just thought, you know, if and when we get out of this and I get home, I know that there's some wisdom that I can pass on to other family members to help them through their journey. We were fortunate to have a family in our community here in Edmonton, but there's so many families that the Stollery serves, or in all over Western Canada, There's single moms, people whose English is a second language. It's a very difficult system to navigate, especially if you have a child with complex needs. So I just really felt like my voice could be heard somehow, and the Stollery Children's Hospital took the leap of faith 7 years ago. Encouraged by family members, they decided to hire a staff person to support family-centered care initiatives at the Stollery, and Marni and I sat on the original council together, and we've moved mountains. We've just done a ton in 7 years, but it's a journey. It's not a destination, so there's a lot more work to do, but we've learned a lot, and we've come pretty far. We've done amazing work.
Great. Thank you, Karen. Together we've moved mountains. That's absolutely true. That's what we can do. Byron, please.
My name is Byron King. I'm from Wetaskiwin, and I am a representative of the HQCA's Patient and Family Safety Advisory Panel. I ended up here thanks to my Ford Fusion, which I bought in Wetaskiwin, where cars cost less. I'm obligated to say that everywhere I go. No, I'm here because a few years ago I was reading our local newspaper, and it mentioned that the HQCA's Patient and Family Safety Advisory Panel was looking for some rural members, and I was looking for a new volunteer experience, something that I thought would put my talents to good use. And when I saw the ad, I thought, I was interested in it. It was intriguing because they did stress that they wanted or were leaning towards people who had experienced negative effects or some bad things with the health system. And for the most part, I really can't say I've experienced anything that really ranks up there. I somehow got selected for an interview. I told them what I've just said, that I really don't have anything bad to say. And they said, you know what, that's not bad because, we're looking at, there are two sides of the coin, and it's not necessarily bad to have someone who, hasn't had something terrible happen to them. So I got on board, and I'm now in my second term and starting to do more, starting to feel more comfortable. It's kind of the, the first term's the learning curve sort of thing, and looking forward to helping out and definitely enjoying my time here today.
Thanks, Byron. Indeed, every perspective matters, doesn't it? Lona.
Hi, everybody. I'm Lona Leiren. I am on the Provincial Patient Family Advisory Group. I'm just starting my second 3-year term as well. I came to this journey as a way of making meaning out of the day that my husband died unexpectedly. I was called to the U of A emergency ward, and he had already passed. And I had wonderful support by the social worker there as I supported my family in that transition. And so, again, attracted to this role. I came through the plethora of other opportunities I've had as a patient advisor to participate with AHS, came to really understand the wonderful, wonderful support that Russell got that day, the support that his trainer got, that she was with him, and the support that I got. And I found this was a way of giving back to the system that I thought had responded so wonderfully that day.
Wonderful. Thank you. Okay, to get warmed up, I'm going to do a little fire round here. So I'm going to make a couple statements, and you need to think of the first thing that pops into your head in 3 words or less. Okay, ready? Byron, first. What ignites you? What or who ignites you?
Lighter fluid, that's why I don't barbecue. Challenge.
Challenge ignites you. Thank you. Karen.
Collaboration.
Collaboration. Lona.
Listening to the innovations of frontline staff.
Frontline staff, beautiful. And Marlon.
Having the fun of starting something totally new.
That's a great one. New. Very good. Okay. Next one. Patient and family-centered care. Karen.
Trust in families as being the expert in knowing what's best for their child.
Trust. Beautiful. Byron.
Inclusion.
Inclusion. Marlon.
Listening.
Listening. Lona.
More than one word here. Recognizing I have a life before I enter your system and I have a life afterwards, and treating me in that holistic way.
Nice. Okay, we're going to get a little tougher now. Healthcare in Alberta today. Lona.
In transition.
Nice.
Exciting changes and lots of opportunities.
Always in transition. Beautiful. Marlon.
I would say totally in transition, but starting towards listening, which I think is absolutely fantastic, okay? I'm seeing people listening.
Nice. Karen?
I was going to say that too, starting to include the family voice.
And Byron?
Agreed, and a desire, obviously, from what we've seen today, a desire to continue to change and to make things better.
Okay, this leads into the next question. Healthcare in Alberta for the future. Lona?
Integrated systems responding to citizens in their home communities, where hospitals are a last resort, and there are integrated service providers in the community to respond.
Karen?
A bigger focus on mental health.
Nice. We've already won the applause rounds. You guys get great applause. Clearly, you're engaging. Byron?
Full accessibility where we, the patients, will be able to access our records and to have a major part in our care.
Right. Very great. Marlon?
Where patients and families are part of the team. They're equally part of the team.
What ignites me right now are the four of you. You're doing great. This is excellent. Okay, let's get a little tougher now. You were asked to participate, observe, engage with people today. I want to know from you, what did you hear that surprised you today? Either positive or negative, but what was something that you heard today that, wow, I never considered that before, that this is going on out there in the conversations? Marlon?
Actually, I listened to how much time and effort there is in making just one small change. It was absolutely amazing to hear that. And I truly admire the person who had made that change, the effort she took, just tremendous. That surprised me. Change, yeah, just let it happen. No, it takes a huge amount of commitment and effort, and I was very surprised.
Wonderful. Karen?
I love that patients and families are being included in studies when they're putting together the initial groups to kind of look at what's going on in their areas. They're also including patient and family members as part of that team. And then I might have heard a few that also I think didn't include patients and families, and I think that's vital for sure.
Excellent. Byron?
What I've heard from the people I've talked to is, and heard from the discussion is, there is frustration with how things are right now and how everyone wants to make things better. And it's amazing how positive, on one hand they are frustrated, but looking at the attendance here and their participation here, they want to make things better, and this is a start, and they're eager to get going.
Definitely. This is definitely the choir here. There's no question. Some amazing people here. Lona?
And just the energy in the room, and also the breadth of things that people are here to present and talk about. And my apologies to the poster people with the flood. I didn't really make the rounds, so I hope they're on someone's captured them with pictures so I can look at them later.
Thank you. Marlies, do you have anything coming in on Twitter? You watching? Okay, while you're doing that, you monitor that, I'm going to ask you then, is there something that you didn't hear that you wish you would have today? And we're going to start with, you were kind of, ooh, yeah, you're thinking about it. I'll give you a second. And Karen.
I knew you were going to say I took notes. What can we do? I wrote, what can we work on? Once again, including patients and families on teams when looking for developing studies. And we talk a lot about supporting families and patients at the bedside, but I think it's critical. It's so critical. We just talked recently about the trust issue, the trust around families and patients knowing what they need. And I think that we have a long way that we need to go in trusting that they are an equal part of that healthcare team.
Excellent, thank you. Lona.
Coming into the last session, the concern I was thinking about is I kept hearing a repeated theme of we can't engage doctors, doctors are disengaged, et cetera. So our last presentation spoke to that. I was really intrigued at a conversation at lunchtime about kind of the elephant in the room of the cultural baggage, probably predating the merger of AHS, and a sense almost that there's a sense of grieving still in the room as people's careers and lives and visions of their future shifted, and some unpacking that still needs to be done to heal and bring together. So I was again pleased to hear that comment as well.
Yeah, that's really quite interesting. We often talked like years ago when we were talking about the Stollery Children's Hospital setting up Family Centered Care Council and thinking, well, we need to get our ducks in a row and not talk about our dirty laundry before we have patient advisors come in. And you're sitting here thinking, we already know you got dirty laundry. Let's help you clean it up a little bit, right? And so I think let's just get rid of that elephant in the room. Beautiful, thanks. Byron.
What I haven't heard, I guess you'd say, isn't so much an omission of sorts, so much as the situation at time, having addressed what we'd like to see, what we need to do, but no obviously great plans or solutions at this point in time because it's not quite the time or place to think about it in depth, and I'm sure given more time, another venue, another gathering, that the brainstorming to how we can actually address these issues will arise from today.
Mm-hmm. Right. Marlon.
I guess for me, it's the last talk that we had also struck for me. I very rarely, let's put it that way, see that physicians, AHS, nurses, alternative medicine, all of the things that connect and have a circle around the patient and that the patient needs to be involved with, there isn't a connectedness. And I would love to see that connectedness because that connectedness is what supports the patients and families and really has to happen.
Excellent. Thank you so much. Marlise.
All right. I've got some Twitter action going. I've got Rhonda Shea. I love the patient panel. I've got Tracy Wasiluk. The patient panel is really rocking. I've got a question from Ann Colburn. At the heart of the matter, patients and family. Take that leap of faith. I want to ask the panel, what will it take to really move us?
What will it take to really move us? You're nodding. Lona, go ahead.
To be getting comfortable being uncomfortable. It's a very vulnerable place to engage parents and families, and yet it's the really learning edge for all of us, and to be willing to take that leap, and we're not going to attack you. We're all on the same team. We want to build the system.
Stressing the muscle helps it grow and get strengthened, right? Byron.
I think, again, along the lines of, facing the uncomfortable, but I think a part of it is on the healthcare side, the providers, the givers, the regulators, et cetera, have to start experiencing and seeing things more from the view of the patients and relating more the empathy. And when that happens, realize that, yeah, even though, someone's a doctor, they're ultimately still a patient. When they get that empathy, that feeling of oneness with those of us, that will help move things along. Sadly, it may take, a personal tragedy or a really bad situation to sort of move some of that along, but, that's sort of where I sort of see things.
Karen.
I just really think it would be difficult without support from senior staff. And Vern, I appreciate that your goal for Change Day was to pay attention to the patient and family voice. You'll have a line a mile long of patients and family members that are willing to come in and help the system and sit as an equal member and collaborative and positive member on a team. But if you don't get the support from the top, and in our case at the Stollery, if we didn't have a paid manager to move all the volunteer work forward and all these ideas and initiatives forward, it would be really difficult. We see that across Canada when we meet with other patient and family advisors, that they don't have support from their senior staff. So I think it's difficult to move if you don't.
What I'm hearing you say is that we can't do this off the side of our desks. We need embedded, dedicated people to support the work of engaging patients and families. Is that kind of what you're saying? Exactly. Yeah. Marlon.
For me, and I'm not talking just from my own experience, I've worked probably with 150 in the last year and a half, 150 patients and families, talking with them over long periods of time to find out what their experience is. And one of the things they're asking very strongly is, please trust us. We know what is happening in our bodies. We may not be able to help ourselves, but please listen when we tell you what it is we are experiencing, because sometimes patients and families do not feel supported by being believed that this is what is real for them.
Thank you. Yes. So trust has emerged a few times throughout this as patient advisors, as patients. So how do we build trust? What do we do to establish that bond that we need to move forward? Byron?
Communication, definitely. Too often, decisions are made and, again, it's the consultation, you're told this is what you need to do, this is what it's going to be. Maybe you don't always get the full story of it. Again, providing us, with maybe access to our records so we can help understand better why that decision was made. But I think that the trust will come with greater communication.
Mm-hmm. That's interesting, because those were some of the comments that were made about engaging with physicians as well earlier, about that communication and building that bond. Lona?
As a patient and a family member, engage us in a conversation about what's going on, be transparent, be honest, as our first patient of the day talked about, respect us.
Marlon? Marlon, yep.
Sorry, I've forgotten the question. I was so busy listening to the answer.
Well,
I apologize.
That's quite all right. No, these are great answers. I had to think about the question as well. We're talking about trust a lot, and you even brought it up. So what is it that we need to do to help build that trust with each other, and certainly for the patient advisors and patients to be involved?
We need to be open, and we need to talk, and we need to talk honestly. We need not to get angry and defensive, because patients can get angry and defensive, so can all the providers. We just need to be open, we need to listen, and we need to accept that people have different views.
Wonderful. And that slide at the very end of the last presentation said that, to be able to listen without judgment. I think that says it well. Karen?
I think finding and empowering family and patient champions. The Stollery was great at that, really bringing family members together with a very wide variety of experiences. Marni and I have very different stories about our children, but we are equals in that we're parents, and we knew exactly what was going on with our children, and we could help and back up the system. So I think the system in supporting champions and will realize through this process that that we are here to help, with one same goal in mind, and that is in the support of our patients and betterment and wellness.
Excellent, thank you. And okay, now what's something that you heard today that you wish everybody here today? You've been involved in your own conversations, but you heard some nugget today that said this whole room should hear this. Give me a second to think. Lona? You're ready to go.
I can't remember, it was the last presentation, last session we were in, and I can't remember, I think it was the emergency nurse, talking about through the change, engaging early adopters to become champions in the process to facilitate change in their peers. I thought that was a great idea.
Excellent. Marlon, what did you hear today that you wish everybody else should have heard today?
Thank you for repeating that. When you're 71, you kind of forget things,
I adapt as I go.
I think the first presentation I went to, of the breakout, I was absolutely, it was wonderful, because this provider was telling us how it takes persistence, how it's persistence, that when you want to make change, you have to be clear and persistent. And I really thought that was very important, and I thought, that's what I need to be.
Wonderful. Karen?
Well, we all heard it, but I loved that Peter Oxlin was chosen to speak, that a family member, and the value of his family voice, and he was allowed to tell his story and the entire process and what it felt like in going through. And it's tough to share those stories. It was tough for me to sit there and listen to it. It takes a very brave person to do that. And I was so glad that he was supported in coming here. But I just wrote a bunch of, we all heard it, but I wrote some words down that were important parts of his journey. And I don't know, we all heard it, but I wrote down mindfulness, respect, calm, tranquil, honest, caring, compassion. And I love that he experienced a great team effort, and that there was balance there, and that his voice was heard. So I think we all heard that, but I think that's so important for us to realize that how important it was to him.
Excellent. And Byron, wonderful. Thank you.
I think it goes back to the comments or the presentation earlier about why change or initiatives can fail, and a big thing was you lose steam, you may hit a plateau, and I think what everyone needs to understand, I want to tell everyone, don't let that happen to you. You're all fighting the good fight, and it can be a difficult, tough, long, hard slog at times, but don't lose steam. Keep going. We support you. We know you're doing a great job, and together we can make it better. So, just keep it up, and don't plateau out. Don't lose interest. Keep fighting. We're there with you.
I kind of want to end it on that one, but I have one more question, but that's a great way to end. Last thing, because with Change Day Alberta coming up, I don't want you to make a pledge for yourself, but on behalf of the group here, what can they do tomorrow when they go back to their offices, to their units, to their sites? What would you like them to do? One thing tomorrow to make change happen. Mm-hmm. Karen, you're thinking. Does anybody want to start?
You're only doing that because you know me.
Marlon, you want to start?
I want them to be excited. I want them to go back with the energy I felt in this room. I've been at many meetings like this, well, quite a few, yeah, with AHS, and I have never felt the excitement that I felt today in this room. Please take that back to your teams. Please keep that going.
Karen.
Continue to listen. Continue to listen and be open-minded to patients and families, and just trust and believe that they're there. That they're there for the same reason that you are.
Thank you. Byron.
Be the agents of change. There's, 170 people here. Go out, spread the word, get more people involved, and the more agents of change that are out there, the better chance that we'll get it done, and we'll get it done quicker.
Excellent. And last word to you, Lona. No pressure.
Take at least one story you heard today and go out and share it with your peers in terms
Wonderful.
of a big change.
So, Byron, Lona, Karen, Marlon, thank you. It's been a pleasure getting to know you over the last little while. I've got some envelopes here for you to thank you for taking the time to be here today. And for the rest of you, stay excited, listen, be the agents of change, and share something awesome that you heard today. Thanks. Thank you.